This is a declaration that contains 10 reasons why human rights need to be at the center of the response. Over 650 organizations internationally and nationally in over 100 countries have already endorsed this declaration, and we call upon organizations all over the world to join this call.
It's been a powerful document, and that's actually why AIDS signed on to it, because it's a powerful, to the point, down-to-earth, concrete rendition of why human rights matters.
By the virtue of being born, everyone has a right to life. And it's critical that for one to sustain life, you need to have access to health care and other important services.
What we know about human rights is that they offer legal guidance, they offer operational guidance, and they offer strong language for advocacy.
See, what human rights did was it gave us language. We were able to say, human beings have human rights. Since sex workers are human beings, sex workers have human rights.
To me, what's really important to understand is that the denial of human rights create vulnerability to HIV infection. At its base, the HIV epidemic is driven by human rights abuses.
I see HIV through a human rights lens. It's such an stigmatized disease. It's affecting disproportionately, the most marginalized people in society, even before HIV, sex workers, people who inject drugs, women in some societies, girls, men who have sex with men, prisoners. So they are stigmatized for what they do or who they are, and then at the same time they are most at risk of getting infected.
Somebody who lives with a drug addiction, just having a clean needle means that the police are all over him. He can't think about getting access to HIV services or HIV prevention. When a sex worker is arrested just for having a condom in her possession, this completely undermines her access to public health services as well and to her own protection.
There are countries in Eastern Europe and the former Soviet Union where a majority of HIV infections are spread through the sharing of syringes by people who use drugs. And yet in these countries, governments have not set any targets for prevention or treatment for these populations. Drug users represent the lowest proportion of people who are receiving treatment, despite representing the highest proportion of people who are living with HIV. This is not a problem of public health. We have the technologies available to prevent HIV in these communities. We know how to do needle exchange, to provide methadone, to provide antiretroviral treatment to people who are dependent on drugs. But whether we implement these policies and whether people can benefit from these programs is a question of their status in society.
The issues for women are particularly severe. The epidemic has a disproportionate impact on women. Women are more vulnerable to infection generally in Africa. Women are not able to negotiate how sex happens. They can't negotiate whether their partners use a condom. When they get infected, it's often hard for them to access an HIV test because they're afraid of the consequences. They're afraid they'll be beaten, they're afraid they'll be abandoned, they'll be afraid that their partners won't take care of them.
Respect and protection of human rights is critical, firstly, to stop people being vulnerable to HIV infection. But also, once you become infected with HIV, the levels of stigma and discrimination and lack of respect for human rights and lack of protection of human rights of people living with HIV makes it much more difficult for them to live with HIV.
They're kicked out of housing, they're denied education, they don't have access to health care.
If a school knows that a woman is HIV positive, we've had instances where children have been denied to be admitted in a school. That is a violation of a basic human right, the right to education. The medical practitioner is not supposed to disclose the test result to your employer without informing you, but they go ahead and do it anyway. And then the employer will terminate your employment on the basis of your HIV status, and they will never tell you it's about HIV. That's another form of discrimination, denial of employment. People who want to get married, the religious leaders say we cannot marry you until you come with a HIV test result. That go get tested, and then we will decide whether to marry you or not based on your status. That's discrimination. Until we actually adhere to some of these basic human rights principles, you're not going to have people coming to test. You're not going to have people then coming to have treatment. You will never achieve this idea of universal access to treatment because people will keep away.
For further information on human rights, HIV/AIDS, and to endorse now more than ever the joint statement, visit www.hivhumanrightsnow.org.